This portion of CardioSource Video News is supported by the makers of Xarelto.
Welcome to ACC.12. I'm Dr. Randy Martin with CardioSource Video News. There have been a lot of very interesting clinical trials that have occurred during ACC.12, and I'm pleased to be joined now by Dr. H.S. Kim. Dr. Kim is from the Seoul National Hospital in Seoul, Korea. Dr. Kim, thank you for joining me.
Thank you for the invitation.
So you are involved in the Host Assure trial. Tell me what that is.
Background of Host Assure trial is we need more intensified antiplatelet therapy for specialized periods such as the first month after PCI, because at that first month after PCI, the risk of thrombosis is very high. So we need a more intensified antiplatelet therapy. There are two options. The first option is double dose dual therapy with aspirin and clopidogrel 150 milligrams per day, which is often used in Western countries.
Yes.
But in Eastern countries, we usually use triple antiplatelet therapy. In other words, cilostazol and aspirin and clopidogrel.
Okay.
But there has been no large-scale head-to-head comparison between triple therapy versus double-dose dual therapy. So in our clinical trial, we tried to test TAT is non-inferior to double-dose DAT.
And you were telling me earlier that this is one of the largest trial that's gone on in Korea, largest clinical trial. How many people were enrolled?
We enrolled 3,755 patients receiving PCI from 40 centers in South Korea. This is the biggest trial ever done in Korea.
Good.
So we randomized them into either triple therapy versus double-dose dual therapy for 1 month.
Okay.
The primary endpoint was net clinical outcomes at 1 month, which was composite of cardiac death, myocardial infarction, stroke, stent thrombosis, and plateau major bleeding.
Okay, so they had very, very good hard endpoints. And you know, the obvious question is, what did you find? What were the results of the trial?
The net clinical outcome, the instance was about 1.4% in 1 month in double-dose dual therapy versus 1.2% in triple therapy. So we observed non-inferiority of TAT to double-dose DAT.
And Dr. Kim, so what? And so it's an excellently designed trial and very interesting results. What's the take-home message or the conclusion that you drew from this study?
So until now, in Eastern country, TAT is very commonly prescribed for patients with high-risk patients receiving PCI, but there's no evidence to support such kind of therapy. So in this trial, we confirmed TAT is non-inferior to proven efficacy double-dose dual therapy in patients receiving PCI, and more, such kind of intensified platelet therapy was very safe and effective. Thus, we think such kind of therapy can be applicable widely to daily practice receiving PCI.
Well, it's a very interesting trial and excellent results, and thank you very much for joining us. Excellent explanation. And thank you for joining us. Stay with us because we'll be having a lot more from ACC.12.